So you're probably wondering about common knee problems. Well, first of all, we have to really kind of take a look at why do they occur in the first place. And the majority of common knee problems occur because of the way the knee joint is made up. So the knee joint is made up of basically the femur, the bone in your upper leg. It has a rounded bottom to it, and it sits on top of the tibia, the bone in your lower leg that has a flat surface to it. Your knee is a hinge joint, so it's supposed to be just like the hinge of a door. But the problem or the difference between the hinge of a door and your knee joint is that there aren't two surfaces that fit into each other and interlock with each other, as the case of a door, but in a knee where they just sit on top of each other. So you have a rounded surface sitting on top of a flat surface, which makes it a very unstable joint, which is why the majority of knee problems get started in the first place. So then we rely on ligaments around the knee to make up for this instability or this deficiency of how our knee joint is made. The ligaments are like ropes, and so when you pull on a rope, it's supposed to be taut, it's supposed to stop, it's not supposed to give or stretch or tear. So rely on ligaments like your anterior cruciate ligament, your ACL, your PCL or your posterior cruciate ligament, your medial collateral ligament, which is your MCL, or your lateral collateral ligament, your LCL. You rely on those being on the four sides of the knee joint to stop the knee from that flat surface from shifting side to side on that flat surface. But as we'll talk about, many times that doesn't stop it from happening. Another way that your knee tries to protect itself by design is that it has something inside of it called the meniscus, or what sometimes you might refer to as the cartilage. So the meniscus is a cushion, but it's a concave, it's curved, it's very rounded, and its job is to kind of create more of a curved surface for the femur to fit into that stops it from shifting side to side. But the problem with that is it's a soft tissue, so it doesn't have a whole lot of strength, but it does try to create a little bit of suction in the knee joint. And then the last way that your knee tries to protect itself or make itself more stable is your kneecap or your patella. Your patella is a small bone on the front of your leg right at your knee joint, and it's supposed to track up and down in a groove in the front side of your femur. Unfortunately, all three of those things don't really work very well very often. And what will start to happen is we'll start to get the potential for each of these three common knee problems. And the three common knee problems really come down to problems with the ligaments, problems with the meniscus, or problems with the patella, because one or a combination of those three things start to kind of break down and they don't really do what they're supposed to do. So again, the ligaments are like a rope, and their job is to stabilize and prevent any slippage or any shifting. But let's use, for example, somebody that's stepping off of a curb or going downstairs, or an athlete that comes to a quick stop like a soccer player or a football player. When that quick stop happens, what happens is the femur is actually shifting in one direction or another on that flat surface. Even just with simply stepping off a curb, as you step down, the femur is shifting or looking to shift forward. So it relies on those ligaments, the ACL, the MCL especially, to hold the joint and to keep it from shifting. But over time, those ligaments start to kind of break down. They get pulled on enough from stepping off of enough curbs, or as an athlete coming to enough quick, hard stops. And what can start to happen is that ligament can start to stretch out, or it isn't as strong or as taut as it's supposed to be. Or in the case of an athlete, you come to a hard, quick stop, and the ligament just can't hold all of that forward momentum, and it'll snap. A meniscus injury, so the second common problem with a knee, as you are straightening your knee, so as you're walking, your knee is straightening out, and as it's straightening out to put that foot out in front of you, there's actually about 7 or 8 degrees of rotation of your tibia. Your lower leg bone is rotating at the same time that it's straightening. Well, that repetitive rotation starts to create wear and tear on the meniscus. Or in the case of an athlete, a basketball player who's making an explosive jump up to get a rebound, for example, that meniscus can get caught in the joint, and the same can happen as you're just walking. The meniscus gets caught. It's supposed to rotate with the tibia, but it doesn't. It stays still. It gets caught in between the tibia and the femur. It can cause pain. If it gets caught with enough hard force, it can actually create a tear, and then it becomes like a hangnail. It's this thing that keeps getting caught on, and it will continue to tear and get greater, or it'll continue to pull back and create more problems. And then the third common problem that we see most often in knees is a patellofemoral problem. So again, the patella is that bone on the front of your knee, and it's supposed to track straight up and down in a groove in the front of the femur. Unfortunately, in the majority of people, it doesn't do that. At the same time it's tracking up and down, it's actually shifting side to side. And that shifting side to side allows the tibia, the lower leg bone, to rotate more. It makes it harder for you to straighten your knee out, etc. But overall, it just creates more of an unstable joint. Again, puts more wear and tear on the meniscus, more wear and tear on the ligaments, and all of these three problems kind of start to intertwine with one another. If you're having any of these problems, any of these three common problems, a ligament injury, a meniscus problem, or a patellofemoral problem, you'll start to develop varying levels of pain in your knee, and that could be sharp pain, it could be stiffness, it could be ache, sore, etc. You'll also start to notice potentially some swelling in the knee. It might be the whole knee, it might be in a specific location. Other things that you could start to feel or start to notice is some popping and cracking that comes and goes with activity, or some stiffness that's there mostly when you're sitting, like if you've been sitting in a movie theater, sitting at your desk, or sitting in the car too long at work, you'll get a lot of stiffness in that knee. Or if you're standing for a period of time, you'll start to get some stiffness in your knee as well. If it progresses and the problem actually gets worse, you can start to have problems fully straightening your knee or bending it as far as you can bend the other knee. You could start to have problems where the knee buckles or gives way, or where it feels like it's very weak when you're standing, or when you're first changing position, or when you're going upstairs. The question we get asked the most is, well, how do I prevent any of these three problems from happening in the first place? Well, the true answer to the question is you need a good balance of strength of all of the muscles around your knee. Yes, we could lump that into quadricep strengthening and hamstring strengthening and calf strengthening, but there's a lot of muscles that come from the front and the outside and the back side of your hip that also help to control what's going on in the knee. And so all of those muscles need to have a good balance, and that's really the way that you prevent knee problems from occurring. Whether you're an athlete, whether you're somebody that just wants to be walking the dog, doing gardening, whatever it might be, you need to have the right balance of strength and flexibility of those muscles. But if you're starting to develop, or you have any of those symptoms that I mentioned, you have any swelling, any pain, cracking and popping, buckling of the knee, stiffness of the knee, difficulty bending or straightening it, or times where it feels like it's going to give way or buckle on you, all of those are warning signs that things are already beginning to happen in one of those three common problems with the ligaments, the meniscus, or the patellofemoral joint. And so what we need to do is you need to get somebody to look at that knee, and that's where an expert physical therapist here at Loudoun Sports Therapy Center comes in. We can sit with you, there's a number of special tests that we can do to figure out exactly which, or combination of which of those three things you're having problems with. We're going to listen to what your symptoms are like, when you seem to have those symptoms, and it helps us to fit together a picture specific to your knee so that we can figure out, is it a ligament problem, a meniscus problem, a patellofemoral problem, or a combination thereof. And most importantly, all three of those things are things that can heal. They just need to be given the right environment, the right opportunity to do so. The only thing in your knee that can't heal itself all the way on its own, with the exception of arthritis, is a complete ligament rupture. And you would definitely know if that had happened. You'd be having a lot of instability. You would have had a specific trauma. Typically it's something that we see in an athlete, or in somebody that has a lot of contact in their day, contact or impact on their knee. But otherwise, all of those ligament problems, meniscus problems, and patellofemoral problems are all things that if we get you evaluated, we can figure out exactly what's causing your problem and know what we need to do in order to get you started on a plan of care that'll take care of it. So give us a call, let's get you in, let's figure out what's going on with your knee, and we'll help you get it healing and back to doing all the things you want to do.